Thanks for staying with us. Many young people are struggling with mental health issues, and sometimes these go unseen as parents are often preoccupied with their own problems. It's said that 1 in 10 children have a diagnosable and treatable mental disorder. This conversation comes as the country marks Child Protection Week and ahead of Youth Month. Earlier, we spoke to Dr Simphiwe Simelane, a PhD student in child and adolescent psychiatry.
I think one of the main things that we have to realize is, like you said, so 1 in 10 children have a diagnosable and treatable mental illness. And the scary thing is that 9 in 10 of those children, the ones that have an illness, will not receive adequate care. So I would not go as far as saying at crisis level, but it definitely is something that needs to be addressed urgently, because at the moment, children are not receiving the care that they need.
If they don't receive that care, pardon me for coming in there, if they don't receive that care, then what happens in their progression to adulthood?
Okay, so the thing about mental illness is, unlike maybe a physical condition where a child might have a bout or a stint of a physical illness and get better, this is something that has a long-lasting impact, like you've alluded to. So it has an impact on the child, it has an impact on their family, it has an impact on society and on the economy at large. And what we see is that when children have untreated mental illness, it results in affecting their schooling, so higher rates of dropout, they have higher rates of absenteeism with these unresolved issues, and then as a result of that, they have lower economic outcomes and higher rates of imprisonment. The other thing is that we see is that families are also affected. Parents are having to take off work frequently in order to address their children. Parents are also sometimes not able to cope themselves with some of these issues, and it can have knock-on effects in this way and generational effects as well.
There's something I've come to know recently, which I'm sure a lot of viewers might not be aware of. It's called parentification. And you think about the fact that in some instances, you either bear the burden of raising your siblings as a child. At the same time, you're drawn into arguments. You're given that much of a burden. That also adds to, the further strain on the children, doesn't it?
Yeah, so I've also recently come to be aware of parentification, or at least the term parentification. And I think that just adds to what we call social determinants of mental health or social determinants of health. And that's just social issues that have an impact on one's health. And so, I mean, in South Africa, we have such a high burden of those with our high unemployment rates, with gender-based violence, poor housing. There's so many to name. That just is one of the sort of symptoms of the greater societal ills that we have. And what we're seeing more and more is more and more research, and including research in South Africa, is showing how those social determinants of ill health, or the things in society that lead to ill health or ill mental health, are some of the so those things are major contributors to the severity of a child's mental illness, so how bad it is, as well as their outcome, so whether or not they're able to get better. Because what happens is that you end up treating them, and then they go back into that situation where they are expected to fill those roles, like you've mentioned, one of the things, or they're expected to live in a house where their parents and them share a room, such things impacts their mental health.
As a final question then, very briefly, let's give parents a way now of spotting when your child is under pressure or has got some of the symptoms. How do we spot them? Because you've got parents who they themselves are burdened with some of the challenges that they're going through.
So it's very important, I guess, for parents to just have conversations with their children, to access the materials that they have. So, for example, in the Road to Health card, there are sort of markers. The Road to Health card is a card or a booklet that all parents are given when their child is born. There are markers of, for example, problems with development that they can be alerted to, that they can then go to their local clinic and tell the staff there if they're concerned. There are also materials on our website. So if they access if they just Google, for example. I know a lot of parents don't have access to that, but if they can see that their children, for example, if they have emotional problems, always sad, or if they are acting up or naughty at school, those are all things that they can go to their healthcare local clinic and ask, could this be a mental illness? But I think even maybe more importantly right now, because of the situation with services and the fact that even if they were to pick up those things, there might not be anyone to be able to pick it up and carry it forward. What parents can do is also fill in a petition that we've recently started, trying to call the government to action. So there's a petition that's asking them to increase the number of resources in terms of facilities, increase the training of people who are at the clinics, because sometimes those people are also not able to pick up the problems, even when parents have a sense that there's something wrong. So if they could do that as well, something we're going to hand over to the Minister of Health on the 16th of June on Youth Day. So partnering, actually looking at your child, and when you are concerned, advocating for your child and actually taking them to your local clinic.
All right.
And then also trying to hold the government accountable for increasing services and the quality of services that are available.